Halitosis, or bad mouth smell, is a microscopic and even surface of the tongue can trap bacteria that produces odours, contributing to halitosis or bad breath, which is so embarrassing and in some cases even causes anxiety. Doctor Shafic Ssonko, a renowned dental surgeon in Kampala, does explain what exactly halitosis in some people.
Bad breath is the continuous unpleasant odor. Even after brushing, within 5 minutes or 10 minutes, you feel your mouth is not fresh. I'm not talking of the transient form of unpleasant odor that we have early in the morning after waking up. No, that is not bad breath. But the bad breath is the chronic, the long-term existence of the unpleasant odor that even after brushing, we can still have the same feeling.
Halitosis does exactly brings low self-esteem to majority persons with such effects, but one asks what causes such bad breath. Shafic Ssonko explains how failure to brush and floss regularly does cause such odor after a sulfur compounds released by bacteria are not removed through brushing or mouth cleaning, among others.
Causes from the mouth are the dental decays, teeth with holes, the untreated decays, the untreated holes within the mouth, within our teeth. And then we have those teeth that decayed to a portion of even having mere roots. Those roots can decay and even form infections within the mouth, or even sometimes pus that causes bad breath. Those decays act as retention sites for food. When you tend to eat or drink something, then food gets in there. Whenever you brush, food can come out of those particular cavitations, then eventually you develop a bad breath.
The physician also explains how swollen mouth gums do cause bad mouth smell, and this is mainly due to mouth gum diseases.
Diseases where we have people with bleeding gums, swollen gums, painful gums, that sometimes even we have tartar or calculus on our teeth. Those are the hard materials. Even if someone tries to brush, they can't get off the teeth, mostly around the gum line. You brush, they don't go off. Those are the major signs of someone who has a gum disease, and of course this can be treated and someone gets better. Even if you brush with that gum disease, your gums are bleeding, you're going to continuously have this bad breath, as long as you've not treated the cause.
Dr. Ssonko further confirms that also diets people have in their daily lives also do cause halitosis, especially those who overtake garlic, onions, alcohol, among others, which include also certain diseases like diabetes, kidney and liver diseases may also have halitosis or bad smell caused in certain people.
Then the second category of the causes of bad breath are those that come away from the mouth. One is our dieting. How do you feed? People who consume alcohol, who take cigarette smoke, who have cigarette smoking, people who have things like garlic and onions which are taken in their raw form, they always tend to have bad breath. But of course that is transient. It is there as long as you're still using the substance you're using, whether it is alcohol, whether it is smoking, whether it is shisha, you're taking shisha, or maybe you're taking onions. Once you stop within a period of 2 to 3 weeks, the bad, of course, automatically the bad breath will. You have diabetes, a condition known as diabetic ketoacidosis. One of the complications of diabetes, someone will be producing a bad breath close to a fruity smell. If someone has kidney disease, one will be producing a smell close to urine. And if someone has a liver disease, like liver cirrhosis and even others, someone will have a breath close to a mouse smell, like the young ones of the rats.
Meanwhile, Dr. Ssonko explains another scenario of people with mental issues always thinking that they have bad smell or halitosis, yet actually they don't have this halitosis, saying such people need a help from a trained psychiatrist.
Someone could be there not having any of those causes we've mentioned, not having any issue within the mouth, not having any issue within the general life. Himself, herself is the only witness to this bad breath. The parents, the guardians, the wife, the husband, the colleagues, their friends cannot reject this bad breath because they have a mental issue. Issues like hallucinations and even monosymptomatic hypochondrosis are the major causes of that. Someone just have, like people have the beliefs that, yes, I have a bad breath, but in reality it is not there. So they should see a psychiatric officer who could prescribe for them a medication that can treat the other mental illnesses.
But all in all, medical practitioners like Dr. Shafic Ssonko are encouraging the public to go for regular medical checkups to avoid such halitosis in the public.
That please let us go for medical checkups. It's very, very important. This habit of waiting for pain, waiting for toothache to go for a dental checkup, that shouldn't be the routine within this 21st century. We should seek for medical checkups within the medical facilities that we are having, both public and private facilities, as long as they have qualified staffs. And lastly, the regular use of mouthwashes is a thing we really recommend. Proper brushing. Let us be brushing. A toothbrush is supposed to be used for a period of not more than 2 months.
Brian Ssenkumba, Channel 44 Prime News.